This first article comes from the Journal of European Radiology. Magnetic resonance imaging is the gold standard for characterization of anal fistula, or AF. Treatment of AF relies on accurate assessment of fistula anatomy, making imaging key to preoperative management. This study aims to improve the clinical utility of MR reports for anal fistula through the use of a minimum dataset to ensure that all key features are described, while still giving some reporting flexibility to the reporting radiologist. The authors reviewed articles describing recommended features to report on MRI and sent a nationwide clinician survey to determine relevant information needed for clinical decision-making with regards to AF. The minimum dataset was developed in multiple staging using this data. An expert panel of radiologists and surgeons then convened to discuss and vote on the minimum dataset. Features that should always be reported include Parkes classification subtype, number and morphology of tracts, anal clock location and anatomical location, relationship to sphincters and pelvic musculature, tract extensions, and presence of any associated collections. Specific and more detailed discussion of each of these necessary points are included in the paper. This next article also comes from the Journal of European Radiology. Gastric cancer, which is the third leading cause of cancer death, is treated most effectively by radical gastrectomy, which has a high incidence of complications that may be severe and lead to death. This study evaluates characteristics of visceral adipose tissue and subcutaneous adipose tissue and their relationship to complication rates and overall survival in patients who underwent radical gastrectomy for gastric cancer. Intraoperative data, postoperative data, and long-term outcomes for 142 patients who underwent laparoscopic radical gastrectomy was evaluated and included in the study. Visceral and subcutaneous adipose tissue features were taken from 3 continuous slices of the abdomen at the level of L4, including Hounsfield unit measurements and cross-sectional area. The perioperative complication rate was found to be 18.3% in this study and was significantly higher in patients with higher visceral adipose tissue area. However, a protective effect of high visceral adipose tissue was found in terms of overall survival. Patients with lower density fat tissue also had better overall survival. The authors assert that a presurgical risk assessment may be developed using features of adipose tissue, which can guide clinical treatment of patients with gastric cancer. This next article comes from the Journal of Ultrasound in Medicine. The current reference standard for assessment of mucosal healing in Crohn's disease is endoscopy. Due to invasiveness, complication risk, and need for general anesthesia in children, alternatives to endoscopy for evaluation of Crohn's disease activity are appealing. This study aims to evaluate the use of contrast-enhanced quantitative ultrasound in comparison to endoscopy. The study additionally compared contrast-enhanced ultrasound to fecal calprotectin and the Paediatric Crohn's Disease Activity Index in evaluation of Crohn's disease activity. After exclusion criteria, 36 children underwent endoscopy, PCDAI evaluation, and quantitative contrast-enhanced ultrasound. 32 of these children also had fecal calprotectin values obtained during the designated time interval. The authors found a moderate correlation between quantitative contrast-enhanced ultrasound and endoscopic disease activity, with a sensitivity of 78.6% and specificity of 100%. Contrast-enhanced ultrasound is great for evaluating activity of Crohn's disease, but cannot rule out active disease. The data from this study ultimately suggests that a combination of pediatric Crohn's disease activity index, fecal calprotectin, and quantitative contrast-enhanced ultrasound are more reliable for assessment of Crohn's disease activity than any one of those measures alone. This next article comes from the Radiological Society of North America. Accurate restaging of rectal cancer is crucial for the selection of candidates for local excision after neoadjuvant chemotherapy and radiation therapy, or NCRT. However, accuracy for T-staging with the current standard of diffusion-weighted images and T2-weighted images can be as low as 52%, with overstaging often leading to low accuracy. The value of contrast-enhanced MRI for rectal cancer staging has been demonstrated in recent literature. This study aims to evaluate the use of contrast-enhanced MRI in distinguishing T0 to 1 and T2 through 4 rectal cancer following NCRT to determine suitability for resection compared to the current standard. After exclusion criteria, 328 patients with locally advanced rectal cancer who underwent total mesorectal excision after NCRT from January 2014 to October 2018 were chosen for the study. 2 radiologists then interpreted the pre- and post-NCRT MRI images for each patient, including DWI and T2-weighted images and contrast-enhanced MRI sequences. If there was discrepancy between the readers, a third reader would act as an arbiter. After interpretation and statistical analysis, the area under the curve for the contrast-enhanced MRI protocol in predicting pathologic T0 through 1 tumors was 0.81, while the T2 weighted and DWI protocol was 0.66. The authors determined that the contrast-enhanced MRI protocol is superior to the current standard protocol, and that the contrast-enhanced MRI protocol provides accurate differentiation of T0 through 1 from T2 through 4 tumors after NCRT. This last study comes from the Journal of Clinical Radiology. Pediatric emergency room visits decreased during the COVID-19 pandemic, during which time a decreased incidence of pediatric acute appendicitis, delayed presentation, and increased rate of complications have been demonstrated. However, in prior studies, despite the decreased number of patients worked up for acute appendicitis, the overall number of patients diagnosed with it stayed the same. This study aims to examine the differences between clinical presentation of patients imaged for suspected acute appendicitis, both during and before the pandemic, to help inform imaging decisions in the future. Twice as many patients were imaged for suspected acute appendicitis during 2019 versus 2020 in the pandemic, despite similar number of patients being treated for acute appendicitis during those years. Patients positive for acute appendicitis in 2019 were most likely to have nausea and vomiting versus diarrhea and constipation in 2020. During the pandemic, patients who were negative for acute appendicitis tended to be older and have more generalized nonspecific abdominal pain versus the right lower quadrant pain in the positive group. This same distinction was true for the pandemic versus pre-pandemic groups. Patients with symptoms of upper respiratory infection and abdominal pain were also less likely to have acute appendicitis. The study suggests that upper respiratory infection symptoms may decrease the likelihood of appendicitis and may factor into precluding a patient from receiving imaging in the proper clinical context. Ultimately, the pandemic did not significantly change the presenting features of acute appendicitis, and imaging is generally justified in these patients as other etiologies for the presenting symptoms, such as enterocolitis, are common and may be found on imaging.